We're all about making sense of health information, and today we're zeroing in on a pretty common problem. We're talking about lower abdominal pain in women, specifically when it's related to STIs.
Right.
And to do that, we're going straight to the source, the Ghana Standard Treatment Guidelines.
A great place to start.
We're going to really break this down, get to the need to know stuff without getting bogged down in all the technical details.
Yeah, cut to the chase.
Exactly.
So these guidelines actually paint a pretty clear picture of what we should be looking for and how to go about addressing this issue.
Okay, so let's jump right in then.
Sounds good.
What are the main culprits behind this kind of pain according to the guidelines? Like, what are we dealing with here?
Well, the usual suspects when it comes to STIs, they often point to Neisseria, gonorrhea, and chlamydia trachomatis as the main players.
Right, makes sense.
But what's interesting is that they also specifically highlight anaerobic bacteria, which I think is a really important point to emphasize.
Why is that?
Well, anaerobic bacteria are often implicated in infections that tend to recur.
Yeah.
So if we're talking about a woman who's experiencing, repeated episodes of lower abdominal pain, this could be a sign that these bacteria are involved.
Okay, so that gives us a bit of insight into what's going on internally. But what about from the patient's perspective? What kind of symptoms might she actually experience that would make her think, hey, something's not right here?
Yeah, well, some of the common symptoms that are typically associated with this are, of course, lower abdominal pain. You might also see pain or discomfort during intercourse, which, the medical term for that is dyspareunia.
Right.
Vaginal discharge is another common one. And then pain or burning sensation when urinating, which we call dysuria, or sometimes it's referred to as urethral discomfort.
Okay.
And in some cases, a woman might also present with fever.
Got it. Now, let's say a woman goes to her healthcare provider with these symptoms. What are some of the things that the provider would look for during an examination?
So when a healthcare professional is examining a patient who presents with these kinds of symptoms, one of the first things they'll do is check for lower abdominal tenderness.
Right.
They'll also be looking for any signs of vaginal discharge. And a really key sign that they often look for is something called cervical excitation, which is basically tenderness when the cervix is moved during a bimanual vaginal exam. And this is often a sign of pelvic inflammatory disease, so it's a pretty significant finding.
Okay, and are there any other things that they might check for specifically?
Yeah, they'll also be assessing for any tenderness in the area around the uterus and ovaries, which is called adnexal tenderness. And in some cases, they might even be able to palpate, feel an adnexal mass during the examination.
Okay, so based on the symptoms that the patient is reporting and what the healthcare provider observes during the exam, what are the typical tests or investigations that are done to really pinpoint what's going on?
So the primary investigation that these guidelines recommend is a high vaginal swab culture and sensitivity test. And this is really the gold standard for identifying exactly which bacteria are causing the infection, which allows us to select the most effective antibiotics.
Makes sense.
The guidelines also mention that a pelvic ultrasound can be helpful in certain situations to get a clearer picture.
Got it. So once an STI-related infection is diagnosed, as the cause of this lower abdominal pain, what are the main objectives of treatment? What are we trying to achieve?
Well, the primary goals of treatment are, first and foremost, to effectively eradicate the infections caused by, the gonorrhea, chlamydia, and anaerobic bacteria that we talked about. And of course, another crucial aim is to alleviate the pain and inflammation that the woman is experiencing.
Right. So we want to address both the underlying infection and the symptoms that it's causing.
Absolutely.
Okay. Are there any recommendations in the guidelines beyond medication, in terms of managing this condition?
There's one interesting recommendation that I found, which is that if the woman has an IUD in place, the guidelines actually advise removing it. But importantly, this removal should occur 3 days after she starts taking antibiotics.
Okay, interesting. Now, you mentioned antibiotics, which are obviously a cornerstone of treatment for these types of infections. What do the guidelines recommend specifically for women who can be treated at home, as outpatients?
So for outpatients, the guidelines recommend either a single dose of cefixime, which is 400 milligrams, or ciprofloxacin, which is 500 milligrams taken twice daily for 3 days.
Okay.
And this is to initially target the gonorrhea.
I see.
But it's really crucial to emphasize that regardless of which of those two options is chosen, it always needs to be combined with both doxycycline and metronidazole.
Okay.
Both of those are taken twice daily for a full 14 days.
Wow, that's quite a course of treatment.
Yeah, and this combination therapy is really essential to ensure that we're adequately addressing the most likely infections, covering all our bases.
Makes sense. Now, what if someone needs to be admitted to the hospital, for more intensive care? Is the treatment approach different in that case?
Yes. For inpatients, the guidelines recommend a slightly different regimen. They suggest using ceftriaxone, which is given as an intramuscular injection.
Okay.
And that's 250 milligrams once a day for 3 days. And then this is followed by oral doxycycline and metronidazole. Same dosages as before, but this time it's continued for a longer duration of 17 days.
17 days.
Yeah, so that injectable ceftriaxone is really brought in for these more severe cases to get things under control quickly and effectively.
Got it.
One other thing to note is that all of these treatment recommendations, according to the guidelines, have an evidence rating of C.
What does that actually tell us about these recommendations? What does that C mean?
So an evidence rating of C basically means that the recommendations are based on expert opinion, clinical experience, or maybe findings from studies that weren't those large randomized controlled trials that we often consider the gold standard. It basically suggests that there's a good rationale behind the treatment, but we might not have the highest level of scientific evidence to support it just yet.
Okay, so in a nutshell, we've taken a pretty detailed look at STI-related lower abdominal pain in women, guided by these Ghanaian guidelines.
Right.
We've talked about the possible causes, the symptoms and signs that should raise a red flag, how it's diagnosed, and of course, the treatment strategies for both outpatient and inpatient settings.
Yeah, and I think what's really interesting to highlight here is how these standardized treatment guidelines aim to provide a consistent, evidence-informed approach to managing this common problem. It emphasizes the value of having these frameworks in place to guide healthcare professionals towards effective and consistent care.
Absolutely.
I mean, think about it.
Yeah.
These kinds of guidelines, when they're applied in all sorts of different medical situations, really strive to create a baseline of quality and consistency for patients.
Absolutely.
Something to think about.
Yeah, it really is. All right, well, that brings us to the end of our deep dive for today. Always a pleasure.
Thanks for listening, everyone.
Thanks, everybody.
We'll catch you next time.